100 groups ಗೆ
ನಾನು ಕಳಿಸ್ತೀನಿ.
100 groups ಗೆ ಮಹೇಶ್
ಸೈನಾಪ್ಸ್ ಟೀಮ್ ಸೈನಾಪ್ಸ್ ಕಳಿಸ್ಬಿಡ್ತೀನಿ.
ಮಹೇಶ್ ಎಲ್ಲಿಗೆ ಬಂತು ಅದು? ಎಲ್ಲಿಗೆ ಬಂತು?
ಪ್ರೀತಿ ಕಳಿಸ್ಯಾರ ನನಗೆ. ಪ್ಲೀಸ್ ಸೆಂಡ್ ಮಿ ಡೀಟೇಲ್ಸ್ ಆಫ್ ಟುಡೇಸ್ ವೆಬಿನಾರ್ ಅಂತ.
ಯಪ್ಪ
ಏನ್ರಿ ಮನೆಯಲ್ಲೇನೆ ಹಿಂಗಾದ್ರೆ ಹೆಂಗೆ ರೀ? ಬೈ ದಿ ವೇ ಮಹೇಶ್.
ಎಸ್ ಸರ್.
ಯಾವಾಗಾರ ಸ್ವಲ್ಪ ಲೇಡೀಸ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಅಂತ ಹೇಳಿ ಬರೀ ಲೇಡೀಸ್ ಸೈಕಾಟ್ರಿಸ್ಟ್ ನ ಕೂರ್ಸ್ರಿ.
ಆಯ್ತು, ರೆಡಿ.
ಲೇಡೀಸ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಪ್ಲಸ್ ಚಿಲ್ಡ್ರನ್ ಬಗ್ಗೆನೂ ಅಷ್ಟೇನೆ.
I'll only have strong opposition from Vijay. ಯಾಕಂದ್ರೆ ಅವನ್ನ ಡಿಸ್ಪ್ಲೇಸ್ ಮಾಡಿ ಇನ್ನೊಬ್ರು ಮಾಡರೇಟರ್ ಆಗ್ಬೇಕಲ್ಲ, ಕೋಆರ್ಡಿನೇಟರ್. ಅದಕ್ಕೆ
ಓಎಸ್
ಸರ್
ನೆಕ್ಸ್ಟ್ 10 days ನಾನು ಲೀವ್ ಅಲ್ಲಿ ಇದ್ದೀನಿ.
ಹೌದಾ?
ಬ್ರೇಕ್
ಬೇರೆ ಯಾರನ್ನಾರು ಒಂಚೂರು ನಾಮಿನೇಟ್ ಮಾಡಿ ಹೋಗಿ.
ಓಎಸ್ ಡಾಕ್ಟರ್ ಮಧುಕರ್ ವಿಲ್ ಟೇಕ್ ಓವರ್.
ಡಾಕ್ಟರ್ ಮಧುಕರ್ ಅಲ್ಲ ರೀ, ಯಾರು ಒಬ್ರು ಬ್ರೈಟ್ ಅಂಡ್ ಯಂಗ್ ಯಾರು ಕೂತ್ಕೋಬೇಕಲ್ಲಿ.
ಸರ್ ಮೇಡಮ್ ಕಳಿಸ್ಬಿಟ್ಟೆ ನಾನು.
ಕಳಿಸಿದ್ರಾ ಸರ್? ಗುಡ್ ಸರ್. ನಾನು ಎಲ್ಲರಿಗೂ ಬೇರೆಯವ್ರು ಕಳಿಸ್ತೀನಿ, ಲಾಸ್ಟ್ ಕಳ್ಸೋಣ ಅಂತ ಅನ್ಕೊಂಡಿದ್ದೆ.
ಇಲ್ಲ ಮೇಡಮ್ ನಾ ಕಳಿಸ್ಬಿಟ್ಟೆ.
ಆಯ್ತು
ಸರ್. ಬ್ರಾಡ್ಕಾಸ್ಟ್ ಆಯ್ತಾ?
ಬ್ರಾಡ್ಕಾಸ್ಟಿಂಗ್.
Yes.
I think you should, sir. Please, Ganeshan sir, please go ahead.
Yeah, we will start. And recording also is happening, so let us over to Dr. Herbie Shetter.
Okay. Can you all hear me?
Yes.
Okay.
Yes.
Right. Fantastic. Okay. Good evening, everyone. My name is Dr. Vijay Herbie Shetter, and I'm one of the consultant psychiatrists and coordinator for this Tele Arogya webinar series. In today's topic, we have telemedicine etiquette, and this topic is the speaker for this topic is Dr. Mohan Sunil Kumar. Who doesn't know Mohan Sunil Kumar? He is a consultant psychiatrist. He's a honorary webmaster for our IPSKC, and he's a director and founder director for Augmenta Healthcare. And he's very active in terms of any web related, online related resources and things like that. So I welcome Dr. Mohan Sunil Kumar. And for a change, the first time in the history of rather in the last if I take the last 4 or 5 years, we have a distinguished guest, Dr. Madhukar VR, who is a consultant psychiatrist, director in Cadabom's group, as well as Manasa Neuropsychiatric Center, and he's the present president of the Indian Psychiatric Society Karnataka chapter. And he is we have a pleasure. It's our pleasure to welcome Dr. Madhukar. He is here for the first time after a long time, and he'll be moderating this. And just for the sake of audience, I'm slowing a bit because people slowly joining in. Okay, and while people are joining in, I'll just give some suggestions. There is a Q&A section at the bottom, and I request audience to kindly put their questions in the Q&A section, and the panelists are requested to look into the panelist means it is the speaker as well as the moderator to please look at these questions in the Q&A section. And also there are 3 sections in that: open, answered, and dismissed. So if you can click on the open and take the questions and discuss it, and then if you say answered, you can move it to the answer section. Or if you're running out of time, you are able to type the answers for the sake of audience, because we have a duty to look after our audience also. They have taken time out of their busy schedule and are attending this seminar, so we have to look after them. That's one thing. And there's a chat box, if you notice, next to the Q&A section. Chat box is only for exchanging messages, and the questions may not be taken from the chat box. So kindly, audience, please post your questions in the Q&A section only. So I'm seeing just people are just logging in. Slowly it's moving, and we have about 40-45 attendees already. Okay, so with this okay, hold on.
Can I
Okay, and I request everyone else apart from the speaker to mute when the program is running. With this, information, I'll just hand over to the main person who is the moderator. Thank you very much, sir. Please, it's over to you, Madhukar, sir.
Yeah, good evening, ladies and gentlemen. First of all, thank you very much, Dr. Vijay, for the wonderful introduction. I hope all of you have your coffee or tea mugs with you. I can assure you it's going to be a very interesting session. First of all, let me thank the Tele Arogya team, IPS, IAPP, Mr. Ganeshan from Microlabs and his team for bringing this webinar series to your homes. We would like to thank our ever-active, enthusiastic coordinators, Dr. Vijay Harbishettar, Dr. Mahesh Gowda, and Dr. Jagadish, who have been working tirelessly for this venture. And thanks to you all active participants in anticipation of a lively and a productive discussion. We all know about the COVID-19, what's happening. The crisis has given us an opportunity to use digital technology in our healthcare. I think it's a month since telemedicine has become part of our everyday vocabulary, like the lockdown, social distancing, use of hand sanitizers, face mask, flattening of curve, everything. So likewise, even telemedicine has. We have had many webinars on various topics, and I plead guilty that I have not been part of many. As many of you know, I am more comfortable on the cricket field than in front of you all or in front of the camera here. Maybe one of the days we will have a webinar on cricket too, and Dr. Mahesh Gowda assures that we will have one. However, I'll try my best to keep it an interesting session, being as a moderator here. It's an honor and privilege to introduce my good friend, Dr. Sunil Mohan, the speaker for the evening. He is going to be talking about telemedicine etiquettes, being effective, efficient, and empathetic during telemedicine consultation. Dr. Sunil Mohan is an alumnus of NIMHANS. He has received the prestigious Ramachandra N. Murthy Foundation Fellowship. He is also a fellow of the IPS as well as IAPP. As Dr. Vijay Harbishettar has already mentioned, he is a founder and director of Augmenta Health, a new age mental health company. And probably he is much ahead of many of us as far as the use of digital technology. He holds important official positions in various national and international associations. He is involved in teaching, training, and digital breakthroughs in the area of mental health. And most importantly, he is the co-creator of Helpy, India's first online suicide gatekeeper training program. He has mentioned several areas of interest like public mental health, neuroeconomics, and use of technology in the mental health space. His philosophy in life is we live life once. Along with all that, I also want to mention he's a very good leg spin bowler. So maybe if we have time, probably we can ask Sunil Mohan about the art of bowling leg spin, which is itself a dwindling science. Over to you, Dr. Sunil Mohan, and you can start your presentation. Thank you.
Thank you, Dr. Madhukar, and thanks for all the participants being here. And I hope, Ganeshan sir, I'm confirming with you, you can hear, right? Voice is fine? Yes, slides are seen?
Sir, perfect. Slides are seen. Your voice is coming superb.
Okay, absolutely. Great. So we are going to talk about telemedicine etiquette. And when Dr. Mahesh initially kind of reached out and was speaking about what topic to address and those, it was thought by us that we should talk about something which is very practical and useful for all of us together. And to reach there is why this whole discussion on telemedicine etiquette. What are we going to talk about? I kind of have three sections in the whole discussion we'll have. I'll try to kind of interact more and kind of keep it going. But when we try to interact, we might lose time. So what I'll do is I'll finish through the idea of what I want to share across. After that, maybe we can take a detailed Q&A session. So the first and foremost thing which I think I would like to highlight is the times are changing, and as Dr. Madhukar mentioned, definitely COVID-19, I think, has changed the healthcare system 10 to 15 years faster ahead. I don't think telemedicine would have got legal so fast. I don't think so many ventilators would have been available so fast. I don't think PPEs and those things would have been discussed so fast if not COVID had not happened. So I think times are changing, and I'm sure we are all witnessing some of the very challenging times. And definitely some of us are becoming more and more resilient, and the country is expected to become more and more resilient too, as per the Prime Minister. Now, one interesting point we need to notice is we have a lot of clinicians, right? Great clinicians, by the way. The first important point for all of us to understand, including me, is we could be great, competent clinicians, but it does not guarantee that we are good telemedicine champions. So even if we are very good clinically, on online consult, we might need to revisit our skill sets and learn some new skill sets. So that's the major point on which I would like to lay the whole discussion further. The next important point I would like to say is a lot of studies have shown the challenge of telemedicine. One of the important challenges of telemedicine you need to understand is you need to understand that studies have shown the impressions which are created by people who are distant from us is most of the times negative, and most of the times it is little different from the reality. So if you take a doctor, right, a doctor patient relationship or a doctor client relationship is based on trust. Now, if you apply this knowledge of psychology, which says distant relationships can question the positivity and it can look the relationships little differently, you need to understand a telemedicine consultation will bring in a lot of question about integrity, capabilities, and trust could become an issue little more than what is happening in a routine clinical practice. So that's an important point for us to remember. Now, there would be a lot of doctors, especially some of them who believe that technology cannot replace human beings. They would say no replacement for live consultations and those. I really agree, but I also would like to say, is it really true is what we need to ask ourselves, because we all know there have been a lot of our patients or clients who have come and met us in person but have been very unhappy with the in-person consultation. It is not an online consultation. They have come to our clinic, met us, paid the money, gone back, and never come back to meet us because they were put off by something which happened. Maybe we made them wait a long time. Maybe our body language did not go in sync with them. Maybe when they met us, they realized that they didn't like the way we deal with them and do so many things. So it's important for us to realize it is not that only online consultations are a challenge. Real world consultations are also a challenge, but day to day we have become so accustomed to it that most of the times we are able to turn the tables and handle it very well. But coming to telemedicine, because it is newer and we are adapting to it, maybe we are having some initial hiccups and challenges, and we need to kind of learn to deal with these things. So when you're talking about telemedicine, the first thing which comes to mind is convenience, especially in a city like Bangalore, where traffic jams and those things are a big issue. A lot of people would prefer telemedicine consultation only because they don't want to waste 1 hour, 2 hours on the road to meet a doctor for just a few minutes. So convenience itself can play a role in telemedicine consultation, right? Second important thing is we can customize the care we can give. We can individualize the care we can give. For example, I'm a consultant, let's imagine handling old age home where there are a lot of people with different kind of mental health issues. Now I can, when I visit there, can talk in groups, but if I want to have an online one-to-one consultation and planning individually, it can be done with less resources utilization. So customizing the care becomes much easier in telemedicine consultation. That's an important point for us to know. Very important point is connecting the dots. We can reach places where we cannot reach physically easily. For example, we can reach places like remote villages by the click of a button. We just need broadband and internet connection. And with rampant availability of broadband and mobile phones, it is going to become easier as days go by. So it's important for us to realize that we should be able to connect the dots much better with telemedicine consultation. And of course, there is a commercialization angle. A lot of investment is happening into the whole telemedicine discussion, and we know sometimes it is commercially viable in all ways. So the institutions, the professionals, even the patients can benefit with the commercialization aspect, because the cost of care can be much lesser compared to real consultations. So with this understanding, when you're talking about etiquettes, why am I talking these things? See, I am not sitting here to say this is right, this is wrong, this is do's and don'ts. We are all learning together. But I think we need to understand the process of change and why we need to think of a change. So we need to all accept that with the changing times, we should be willing to welcome wholeheartedly very interactive, participatory patients. No more patients are going to say, doctor, you are God, you tell, we will listen to you. You say, do this, we will do. No. Today, you will have patients who will come and ask, why this medicine, why not that medicine? Why 5 mg, why not 10 mg? Why in the morning, why not in the night? Should I really take medicine? So I think we need to be willing to welcome this new breed of patients and people who are going to be more interactive and who are going to be more participatory. They want to take their choices. They don't want to just listen one-sided. So we need to welcome them. And most importantly, what's our pursuit in the journey? Of course, we want to be happier, healthier, and we want to be stable enough financially to take care of our own personal goals. But as a health professional, we have a pursuit, right? The pursuit is to cure patients whenever possible. If not possible to cure, at least care them to the best extent possible so that the quality of life is much better. So cure and care is the pursuit which we are looking for. This is where, I'm putting here personalized psychiatry, but I know some of them who are participants might not be in psychiatry, but might be in allied medical fields. Telemedicine consultation is the same for all of us, by the way. So the rules are applicable. What is personalized psychiatry? We are talking about tailor making multidisciplinary approach into tailor-made customized one setup. So that is what is called as personalized psychiatry. So when you're looking at personalized psychiatry, we can look at a few important areas. One is we can work on prevention. We can then also work on prediction. What do you mean by prediction? Okay, is this person going to be in higher risk of a problem or not? So that is something we can always work upon. Personalization, depending on each patient and client's need, we can always work on personalized plan which can suit that particular individual. A simple example I can give you is, let's imagine there is an antidepressant which is effective but costs 40 rupees, but there is an antidepressant which is equally effective but costs 20 rupees. Now, if at all there is a choice to be given, and finances is one of the major concerns, it is not just important to write one good medicine, it's also important to personalize the care, where we understand the nuances of the economics of this individual and tell him, see, these are two medicines, both work fine, I think this might be a good choice for you. So we have seen in a practice that the clients also are actually very reciprocative, and they appreciate the fact that we understand their nuances of problems. So personalizing the care becomes an important component of our etiquette of clinical management, not just telemedicine. Participation, as I already mentioned, we will have a lot of questions being asked by people. People will ask questions. People will want to know more as details go by. So, and in telemedicine consultation, the breed of people who would reach us would definitely be more tech savvy, which means they do more Google search, understand more, which basically means they might actually have even more questions. So we should be ready for dealing with the questions in their head, and we cannot shun it off just like that. But one thing which cannot be ruled out in any healthcare system approach is what's the goal. Our goal ultimately is, if there is a treatment or a strategy, we want them to be compliant with it. We want them to follow that. We want them to adhere to the treatment. If it's few weeks of treatment, few months of treatment, we want them to stick to it. And of course, we also, as doctors, appreciate people who participate with us. And I'm sure as a doctor, most of us would accept a lot of our knowledge base has improved because some patient at some point of time has questioned us something and we did not know the answer immediately. We came back and did some homework. So it's important for us to understand patient participation is not beneficial only for them. It is pretty much beneficial even for us. So telemedicine success are simple parameters. I mean, if you go and want to read on telemedicine etiquettes, everybody's going to talk about have a proper environment, have a proper equipment, dress properly and appropriately, conduct yourself okay, and communication is important. Of course, the basic thing is professional abilities. If you don't have decent professional abilities, no etiquette will help you. So I think these are the basic parameters which we need to be looking for, right? Environment, equipment, dress, conduct, and those. I will try to highlight some of the important factors here. So as doctors, we have moved away from bedside manners to webside manners. Now we need to talk about webside manners. How do we need to present ourselves online? How we need to communicate online? How we need to kind of reply to some of the concerns which people have. So this needs rebooting ourselves as professionals and learning newer skill sets. Another important thing we need to also know is as times are changing, there is a need for increase in presence, and especially in telemedicine consultations, right? Because we are not there face to face, our presence has to be enhanced so that it can reach those people. So people who are sitting way away from us and listening to us or seeing our message should be able to get that feeling from that. So we need to increase our presence in website manners. Of course, it forces us to become little bit tech savvy, learn some technological jargons, learn some technical alternatives and those over a period of time, and learning to control the strategies. Why should we learn all this bedside to website manners? The reason is very simple. See, etiquette, one very important step would be talk, where we need to know how to talk, how to kind of socialize, how to kind of professionally handle. The reason is because let's take WhatsApp, which is a mode by which telemedicine consultation very frequently can happen. Now, a lot of clients would be chatting with friends where they are sharing their distress about mental health and those things, and they are getting some suggestions from their friends. Here are we who are mental health professionals who are also talking to them on the phone or a video call or a chat message and replying back to them. So how would our talk be considered more professional rather than social? So how can we change that? That is where I think using the right words, trying to keep it very formal sometimes, trying to use methods and strategies of asking ourselves what is working well will really help us to change into these website manners. Now, one important point of pillar which we should remember in website manners is at any point of time, you should ensure that the comfort zone is maintained. Your comfort zone and the client's comfort zone on the other side, in terms of time, mode, people, context, whatever you do should be comfortable enough. Just imagine, as I'm talking to you, hundreds of people are walking in between, or I'm kind of attending phone calls here and there and those. If I end up doing so many things, it's not going to be a comfort zone for you and me. So getting this comfort zone. So these are some parameters which we will be looking at in website manners. So one of the important things which we should understand is looking at appointment tips. So when we are talking about appointment, one thing which we need to understand is, as a professional, telemedicine consultation is not a easy way out. I'm very busy, so let me take phone calls on the go. Maybe when I'm driving back in traffic jam, let me finish 2-3 phone calls and make a few extra bucks. It doesn't work like that. It is important for us to realize that appointment has to be given in a specific time, and it is always good for you to be ready and prepared and waiting for the client to connect with us. So being prepared and ready and working on it is important. And sometimes it needs us to invest some money to buy some decent gadgets with a decent kind of resolution of the camera or a earphone and all those things, because we want to give a good experience for them, right? So some investment sometimes becomes necessary. If our house is very cluttered, sometimes that's okay. Even if we don't want to clean up the house, maybe we need to find some screen system or some method which can make it decluttered and professional looking. So these kind of systems we need to invest at. We should be ready for glitches, and we should be ready for broadband suddenly not working, mobile network going, something not happening as per our plan. And we should have some alternative or the other. Like today when we were logging in, I logged in two systems. They asked the reason why. The reason is very simple. Just in case something goes off in one of the systems, I can still continue with the other system. That's the same goal with which we need to work with. As much as possible, having alternatives would be typically helpful. Next important thing is, in a telemedicine consultation, it's always good to be in control. In control of what? What is being seen, what is being heard, and what experience are we giving to them? So that's extremely important to look at. And these things will improve our credibility miles apart. Even if somebody is reaching to us multiple kilometers away, who have not even met us, who don't even know how we look and whatever it is, when we come on screen, the way we show the control in that 45 minutes to 1 hour's time of consult will actually make them trust us. So we need to be in control of time, what is being seen, what is being heard, and the overall experience of the telemedicine consultation. I did mention about improving our presence and increasing our presence, right? So that is where you need to understand, what do I mean by this video presence? How can I make myself bigger than what I am on a video? So basically, one is creating a very sensible background. A lot of times, a background itself will tell a good thing about how professional the individual is. Most of the times it's preferable to have as much as possible a clear, simple background. If you want to have more professional looking, something like a library or something like that, you can have it, but be careful that the background should not be so interesting that instead of seeing your face, they are seeing the titles of the books behind you and kind of listening to, oh, he's reading this book, is it? Oh, he's watching this video, is it? I mean, that might not make sense. So I think background should not steal your presence, so be careful about it. And of course, the way we dress up, the way we kind of portray would be very important. Many times, especially when the COVID lockdown was happening, most of us would have picked up phone calls from home. Yes, I understand we are at home, t-shirt, jeans are pretty much okay, but if we are taking up a consultation and if you're getting onto a video consult, it's always preferable to be professionally dressed. And it just makes the other person understand, okay, I'm not chatting with this guy, I'm consulting with this person. So he takes our words much more seriously. And we want that, right? As a mental health professional, many times we realize we are not going to tell something very different from what their grandmothers and grandfathers with their experience tell. We tell many times the same stuff, but why do they listen to us? The reason is because they believe we are a credible resource. The credibility of a resource increases by the way we present ourselves, the way we dress, the way we present ourselves, the voice, the tone, the sound we use, all those things matters. Proper eye contact as much as we can helps. Now, it is very difficult to look at the camera and constantly keep talking, but it's a good idea to learn to look at the camera as much as we can. And it's a skill. And as we are learning that, it improves over a period of time. So keep looking at the camera as much as you can and try to deal with the consult. Improving facial expression, and facial expression has to be little exaggerated, because most of the times they see us in a small screen, they might not be able to appreciate the nuances of our facial expression. So if you have a smile, have it little more broader, and if you're showing some expression, having it little more exaggerated could help online for people to understand on the other side. And when I'm talking about facial expression, it is also important, if you realize their facial expression changing, it's a good idea to highlight. A very good example I can give you here about tone and voice is like today, I remember in one of the consults when I was talking, there was a new person who reached out to me for the first time. And as she was talking, I could see the voice is shivering. She looked very anxious, tearful, and those things. I said, see, I'm just hearing your voice, but as I'm hearing your voice, I can definitely understand that you're going through significant amount of stress and anxiety. It appears to me that you're tearful. The person paused there and actually took a deep breath, drank some water, and said, Doc, I'm really thankful that you're able to understand me. Now, this is something which can help in telemedicine etiquette. The other person who's sitting there understands that we are not treating them as digital object. We are treating them as a human being, and we are treating them as a human being who has their own feelings. So picking up these nuances and appreciating that would matter. A very important point you need to understand is anything and everything during the consultation can play a role in the quality of the consultation. Anything and everything can play a role. The lighting, the sound, the voice we speak, the energy we show, everything can play a role. So be as much as in control about various aspects. Of course, any clinician will agree we have to be great listeners more than advisors. So we need to be active and benevolent, and that is what our clients also expect, right? So we should be able to decode the verbal and non-verbal, the tangible and intangible messages our clients give. Sometimes what they are talking and what they want could be very different. So it's good idea for us to clarify with them why they are consulting, what is the need, and especially if they are people who also can come in person but choose to have telemedicine consultation. It's a good idea for us to check with them, why are they not dropping into the clinic but preferring to have a telemedicine consultation. That also gives you an understanding of what exactly the person wants in the telemedicine consultation, and our job is to see as much as possible can we deliver what the other person wants. That makes us better clinicians and effective clinicians. Now, a very interesting point, which I was also coming up when I was reading about telemedicine etiquettes and those is, I mean, we are supposed to be empathetic and we have to text empathy. Now, we have been taught clinically how to be empathetic and kind of, we know in basic counseling skills, how to kind of be an active listener and empathetic. But how do you text your empathy is the question. That is where I think we need to learn to use right words at the right time and learning to use the words in sensible manner. The best thing I can say is when you communicate to people, whenever you have found some messages to be very effective to the individuals, you need to ask yourself, how did you phrase the sentence, or what kind of words did you use? That might give you inputs on what kind of words you could use to show empathy. It is good idea to use emojis as much as you can, but the danger of using emojis is um, you need to know what kind of emoji you should be using at that right feeling, because if you use a wrong emoji, then we are in trouble. So it is good to use emoji to show empathy, but use the right emojis as much as you can. And a very good thing which they have mentioned many times in texting empathy is we need to text what we feel when we saw the message. For example, if somebody has messaged, let's imagine our phone was on silence and we see about 10-15 messages of why the person is feeling so depressed and feeling suicidal and those things. I think when we see the message and respond to them, okay, come and meet me for a consultation tomorrow or something like that, that can be done. But I think the first few points which also could be showing our empathy is to say, I did see series of messages. The first thing which ran in my head was, it looked you're quite distressed, and unfortunately I cannot see you immediately. I might only be able to meet you in the morning. So when you're expressing to them that you feel that ambivalence in your head, that you are not able to meet them, and those gives them the idea that okay, this person is empathetic and is able to understand. So we can text empathy, we can text our emotions. So use this as much as you can to become more effective. Now we always know silence is silver, mute is gold. What does that mean in telemedicine etiquette? When we have no business to talk or we don't want people to hear anything what we are talking, please find out where is the mute button in your phone and press that mute button. Because a lot of times what happens is we don't know what the other person would be listening to, and it unnecessarily can put us into big troubles. This is especially important in major professional meetings, because in many meetings what happens is we don't know that the mic is on, and we keep talking about our own boss or colleague, sometimes negatively, and it can be in trouble. So it can cause a lot of problem, not just in one-to-one consultations, even in group consulting, and even in meetings and those things. So please always find out where is the mute button and use the mute button sensibly. If we are not going to talk for the next few minutes, no point in having the mic on, because there'll be disturbance. So you can just put it on mute and continue to listen to the other person. I'll bring up a very interesting point, and I'm sure a lot of us have already got into the telemedicine consulting, and you also would be witnessing it. Typically in a real consultation, what happens is we say, come back and meet us 2 weeks later, 3 weeks later, or something like that, depending on what is the issue, right? And most of the times people turn up in that time. In telemedicine consultations, many a times you'll notice there is a follow-up enigma. What do you mean by that? Um, if you say people to consult back with you 3 weeks later, many times just after 30 minutes you'll see a message from them. That's why I put one of the challenges we'll see is follow through. Forget about follow up. They just keep following up. Follow through. What do you mean by follow through? After half an hour, they would have spoken to you for a long time. They would have been happy about the consultation. After keeping the phone, 30 minutes later, they'll message, Doc, I forgot to tell you that my pet died about 6 months back. Now, uh, I mean, that is really important. It was important. If they had shared at that point of time, we would have understood what is the nuances. But what happens is a lot of times they continue to follow through and keep telling a few more questions and few more discussions after that. Now you cannot completely avoid it always, but I think in a gentle way, I think we need to say, yes, it is important. We'll take up this discussion in the next consult and those things. So I think it's important, as clinicians, we should be ready for more follow-through questions in today's world of telemedicine consultations. There's no point in getting upset about it. We would lose our patients. We need to learn to deal with this follow-through kind of questions, which will come post-telemedicine consulting. And a lot of instant clarifications people want. Like, for example, you say, take the medication, they go home, take the medicine in the night. Next day morning, they get up, they say, I'm feeling a little drowsy. Do you think it's because of the medicine? What they want from you is to say, yes, it could be because of the medicine. In the next few days, things should be okay. You have started the medicine just yesterday. Give some time for the medication to kick in. They're willing to listen to that, but they want that clarification. If we don't clarify that, they feel very uncomfortable about it. And this is something which is going to increase more and more with telemedicine consultations, because people think, okay, anyways, I can reach out to the doctor, so let me reach out. So that's something which people are going to do. And I've seen this, at least in my consultations. I'm sure a lot of you also might agree. There is a law which I have found in follow-up. There is diminishing returns if people follow up very frequently. Like, for example, if you see somebody who's reaching out within the next day, within 2 days, within 3 days, within more frequently, slowly we realize most of these people actually drop out of our consultations or consult somebody else, or somewhere they don't follow our instructions and move on. So this itself gives us a cue that if they're reaching out repeatedly, maybe somewhere we were not able to gain their trust. It could be our fault, it could be their fault, it could be nobody's fault. But I think it's important for us to realize that these are nuances which are changing in telemedicine consultation, and it's good idea for us to be more open to look at these options. So in etiquettes, we all know what we are supposed to do, but it's also important the major bloopers or the major problems which you can face. Background. Let me tell you one thing. If at all you're sitting at any place and consulting, it doesn't matter which place you're sitting in, please don't have a door behind, and hopefully the door should not be opened by anybody and somebody coming in. That is completely no. So even if you're sitting in a room where there is a room, have that, where there is a door, have that door the opposite side. So even if somebody comes in, you can show them some action, something like that, that the client doesn't understand somebody walked into the room, because nobody likes to see somebody else walking into the room, especially if they're having a telemedicine consultation with you. So that's something which we should be extremely careful about. Not just being careful about the clean kind of background, you should also be careful about people not dropping in and those things. I've put here about noises. Now, when I say noises, some of the noises which you should be ready with is there could be a pet at home or the neighbor's pet which starts barking, and obviously it doesn't understand that you have telemedicine consultations going on. I think it's very natural for you to say, I really understand you might be hearing some barking noise. It's the pet in the next house. I'm sorry for it. I mean, if you tell them that you are a human, there will be problems which can happen, people are willing to listen to. And sometimes the whistle goes off, kitchen, something falls off. All those are problems which can typically happen. And I think how we deal with it and how we show control during those situations will show how professionally we deal with this kind of scenarios. That's the key for us. So control of that whole consulting experience will say how professionally, how effectively we can manage. People, as I mentioned to you, nobody should drop in as much as possible. And one of the reasons I always try to use a kind of a headphone, and when people initially call up, right, especially in a video call, I always tell them, I can hear you. I kind of point it out on my earphone. One reason is because I want the other person to understand you're not on speakerphone. It is not like everybody can hear you. I am the only person who's listening here. So that is going to give the other person the confidence to say, okay, this guy is listening and nobody else is listening. That kind of gives them the comfort to kind of talk about their challenges, right? So these are some things which we need to be looking at. So in simple words, you can take the consult process and look at a few important points. Pre-interaction, even before the consult happens, people can have viewpoints and those. Post-interaction, post the consult, people can have their viewpoints and those. When I'm saying viewpoint, it can be the consultant's viewpoint, it can be the client's viewpoint. We have an opinion on the client has an opinion on us. So both matters is what you need to understand. And this can be different pre-interaction as well as post-interaction. So let me give a interesting point here. For example, I take up a lot of telemedicine consultations on WhatsApp video calls or WhatsApp voice calls. Now, what happens here, if that person has to reach out to me at a particular time on WhatsApp, right, he's going to store my number, register it as Dr. Sunil or something like that, and he's going to call me up. The first thing which is going to happen is he's going to see my profile photo. Now, when he sees my profile photo, most of the times he's going to see what is the kind of status. He's going to see what is the message he has put across, what kind of profile photo. Now, that itself will make a lot of people have opinions on us. Now, why am I telling this? We can say that opinion does not matter, but in reality, that opinion too matters is what we need to understand. So etiquettes is not about how we behave in the consult. It is also about how we behave even before a consult starts and even after a consultation happens. Like, for example, if I say, okay, after I'm keeping the phone, I'm going to send you a prescription in 30 minutes time. It's a good idea for us to send the prescription within 30 minutes time. The worst thing to happen is 31st minute, we get a message from that person telling, sir, I think you've forgotten to send the prescription. So I think it's important for us, if we commit to something, stick to it. That's something which we need to be really looking up to. So we should be willing to look at newer boundaries of together management. What do you mean by together management? Together management basically is looking at how together as a consultant and a client, sometimes family involved? Can we work together? And this needs newer boundaries, right? We become more participatory. And telemedicine consultation, we enter into their homes, we enter into their rooms. So we need to understand the boundaries and nuances. And it is human for some of us to sometimes get distracted. Like, for example, if the client is speaking to us and if the background is very hazy and a lot of things are happening, sometimes we get carried. What is that? Why has he kept this there? So it's human for us also to kind of get distracted. So it's important for us to understand learning this to boundaries of together management is a skill set, and that will happen only with time. So what is happening to the whole doctor patient relationship in the whole telemedicine consulting process? Are we humanizing the telemedicine consultation, or are we technologizing the consultation is what we need to ask ourselves. Are we becoming more gadget oriented? Are we becoming human oriented? Both has its benefits. The best benefit would be is a combination of it in a sensible manner, right? So I'm sure there are definitely a lot of fruits of telemedicine. There's no doubt about it. Patients definitely can benefit. There's no thoughts about it. Professionals invariably can benefit in terms of satisfaction of delivery of care. Institutions can benefit. That is why a lot of institutions are investing into telemedicine. Healthcare system as such can benefit. We would not get paralyzed. Today, even with COVID-19, if at all healthcare system has been maintained healthy, it's surely because of the technology backup which all the professionals and the clients could access to. So that's the importance we need to understand. So when we need to move beyond care, we need to understand we will definitely have very good etiquettes and respect our clients if we realize our clients are not just wanting cure and care now, they want respect. They want dignity. They want autonomy. They want to collaborate and take decisions. They don't want us to say, 1, 2, 3, do this and come back. They want us to talk to them and say, these are the options. What do we do? They prefer a menu based approach rather than very directive approach. And they want us to accept that they can refuse. They can refuse inpatient care and say, I don't want to get admitted. And we should, without a frown, accept it. And say we are willing to help them whenever they come back. I think we need to learn to deal with these things. These are newer challenges which we need to kind of work up with. So as we are embracing the technology of telemedicine and those, we will have challenges about usability, user interface, and user experience. In simple note, I would like to say is things are becoming much more easier today. A 2-year-old child today can use technology pretty easily. The reason is because user interface and user experience is pretty easy now. So it can be done. So as a doctor or health professional, we are all very equipped with basic knowledge to actually embrace technology. So we should not hesitate to embrace technology and move ahead with times. So we should be careful about our digital patients because sometimes we can objectify them. Because I've not seen them in person, we look them as digital avatars. We don't see them as a flesh person. We don't see them as a human being. So that might sometimes make us not think proactively about healthy, holistic decisions for them. So be careful about it. Don't get into the trap of objectification of your digital patient. And we all know today evidence-based medicine and those things are big issues. But in telemedicine consultation, what happens is a lot of data will get generated, which means evidence-based medicine will become more emphasized. So be careful. Don't keep always looking for data points and get stuck with it. Look at clients as human beings and not data points. Don't always look at cause and effect trap. Don't link, okay, this and this are always linked, because sometimes a lot of things have no link with these situations. Very important thing is sometimes as doctors and health professionals, we believe we have to intervene and do something when somebody reaches to us. For example, it sometimes astonishes us. How can I ask for a consultation charge when I don't even advise him some medication or advise him some therapy or something like that, right? So I think it's important for us to understand just reassurance also is a healthy advice sometimes. Sometimes if we say, we don't know what's happening. We need to wait and see. I think it's a good idea for us to say, let's wait and see for the next 2-3 weeks how things are, and then we'll touch base. So I don't want to put medications or something like that, but I am thinking of a few things. Let me say in next 2-3 weeks and take it over. So instead of becoming too much intervention prone, instead of having always solutions to the problems, sometimes taking a step back will make us become more human in the approach to our digital patients. And number fixation is an issue. Why I'm stressing this point is because all our telemedicine consultations will become numbers and data points, which is one of the worries, because we will slowly lose our clinical acumen and looking at individuals, but we start looking at numbers and percentages of people. So be aware that we should not become victims of objectivity. We should not become a protocolized professional, like protocol wise, okay, yes, no, algorithm, I need to follow this. The people who reach out to us, whether it is telemedicine or real consultation, they reach out because they think they are reaching out to a human professional. They're not reaching out to an app or a chat bot which will say, as per algorithm, this is what you're supposed to do. They want a human connection. So we should ensure that that happens. So this is something which I came up with in my head. So I thought I'll share it with you. Whenever I am consulting, I'm asking myself, am I trying to only protect myself? Because with all the legalities and worries about litigations and other things, right? So a lot of times we are always wanting to ensure that we are safe and not going to get into litigation. So we are asking all the questions only to tick mark. Okay, I've asked this question, consent taken, this done, that done. Okay. So basically, I'm legally safe. So sometimes in this process, we lose the human touch. So I think we should not be tick mark head consultant. We need to be a human consultant, which basically means we need to kind of look at nitty-gritties of emotions and feelings and what the person is coming up with, and then take it further. So how do you do all these things? Whatever I'm talking about, it's very simple. Look at the patients or the clients with these following lenses. Look at them with having their own obligations, having their own expectations, and most importantly, understanding each one person has their own unpredictable novelty. Each individual, even if I have seen all through my life thousands of depression patients, the person who's calling me now is different in his unique experience. If I understand that, I am going to give importance to his experience and nuances. That will make the other person feel very felt and understood. That's the most important thing we need to look at. So key to any development is obviously data and feedback. Learn from your own experience, which consultation worked for you, which consultation created problem for you. By that you will know how to kind of go about and dealing with this nitty gritties. There is no one way. We are all bound to make mistakes, but we need to see we should not make the same mistakes again and again. So that's where collecting your own data, collecting your own feedback will help to change the nuances of your professional etiquette and make yourself more effective in the whole process. To summarize, whatever I'm telling, if at all we are looking at, we need to understand we need to be balanced in the way we approach. We need to balance technology. We need to balance human approach. That's the only way we can deliver telemedicine etiquette at any point of time. We are great clinicians. We are great healthcare professionals, but that doesn't guarantee technologically telemedicine consultations will work out effectively. We have to relearn. We have to unlearn sometimes. We have to upskill sometimes and work with the times which go by. But always understand we should avoid any kind of abuse of the technology, and we should also reduce our own bias which we carry about technology. If we do all these things, I think we should have great telemedicine etiquette in our hands to deal with rest of the scenario. With this, I am done with my presentation. I am welcome to take any questions and any other suggestions and those. Yes,
First of
Ganesh.
all, yes, first of all, Dr. Sunil, it was a wonderful presentation. I
Thank you,
wish
sir.
that we had had this presentation much earlier because it's been extremely useful, educational to all of us, informative. And
Thank you, sir.
just to share my own, I am very much a reluctant person to this technology. I am
Yes, sir.
taking time to get used to it. So there are the comfort levels in the physician, in the psychiatrist or any medical professional too. I think we have
Exactly.
about 10 minutes or so to
Mm.
go through some questions. And
Sure.
just
Sir, you
so that
take
we,
your own time, sir. There is no issue up to 8:30 also. I mean,
no, at the same time, we want the participants to ask questions. We don't want them to leave after 7:30.
yeah.
Okay, so we'll try and make it as much as useful for all of them. See, couple of questions about the equipment that have also has been answered by some of the panelists, but what's your own experience, Dr. Sunil, about looking at the camera, looking at the client or the patient, and what's your take on that? How do we manage both?
Um, See, one is, of course, we are looking at equipment. Equipment, um, it's always, I mean, the technology has improved so much that the basic smartphone today has a decent camera. So the baseline has got better. So any decent phone has a decent camera for us to work on. As I already mentioned, it's always a good idea to use a Bluetooth or a wired earphone system rather than speaking in a speaker phone, because a speaker phone will pick up a lot of noise which could be distracting. So it's always good to use a headphone kind of a system. Some people prefer to use this big one. That is also pretty good because the other person there understands you are using such a big headphone that is only you are listening, so they might be feeling more comfortable to take it up. So that is with relation to the equipment and those. Now, a lot of people, if they have a lot of video consultations, buy a full HD camera and fix it up on their laptop, because the laptop cameras are not as efficient as the full HD camera. So you can connect it and use, so that your visuals are much better. The clients will have great experience. Of course, we can't expect them to use, because sometimes people are using from remote places and those, and they might not know how to use the technology also. So we need to be kind of willing to deal with those kind of challenges sometimes. So that's something which we need to look at when you're talking about equipments.
See, Dr. Swaminath had a question.
Yes, sir.
Would it be better to have a direct consultation for the first visit, so that the rapport is established, and subsequently the video consultations or teleconsultations could continue? What's your view on that? Is it
Uh,
better to have that way, or
I think this comes with a framework of two things. One is legality, where if somebody meets you in person, you know it's a real person, you know, or to some extent, okay, this is the person, this is the identity and those things. So we are a little more sure about the individuality of that person. Second thing is, it comes from, with a premise and a belief that we meeting them first time improves the rapport. And since it's a question from Dr. Swaminath, is one of the senior most psychiatrists, I'm sure he's going to agree that there are a lot of people who meet us only once and never come back to us and has gone back to some other consultant. If at all that consultant is a good friend of us, would have come and told, oh, this guy came and told he got put off with you and those things. So if we actually look at, not necessary that all real consultations are great consultations. So I think we need to take it off from our mind. Of course, the legality aspect we should be careful about. Like, for example, if you have doubts about the individuality of the person, if you have doubts about the intention, why are they reaching on telemedicine consultation, you can do a double check on it. You can ask for the Aadhaar card details, or you can ask for identity proof and those, which the government says you should do before your telemedicine consultations, if you, especially if you're worried about identity. But I think it's a good idea to have a real consultation. But if it is not possible, I still think we have had great success in people who have actually followed up online and online and online only, and they've done decently well. And it shows that we could help online too.
right? Dr.
So,
Satish has a question about medical records. Would you recommend that the patient send you the records before the consultation, so that you can go through that and you are well prepared as to why the person is consulting you?
that's a great question. if people reach out and say, for example, if they say I'm kind of reaching out for a second opinion or something like that, I always say, if you have any documents, prescriptions, papers, just take photographs and send it to me beforehand so that I have already looked at it. So it saves their time. Otherwise, when he's on online consult, I need to kind of do it, which means I'm wasting his time as well as our time. It doesn't help any one of them. So if they reach out to us and tell them, we could do. Sometimes what happens is they would have fixed an appointment. We don't even know with what history they come up. When they're talking to us, they say, I went to this doctor, that doctor. So if we have some confusions, like for example, sometimes it happens like they've already taken 4-5 antidepressants or medicines and it has not worked for them. Now, I don't want to prescribe the same medicine which he has already tried and failed. So what do I do in that scenario is I say, I've listened to you.
Right.
What you do is you send me across all your documents. I'll have a look at it, then send you a prescription of an antidepressant. So what happens is, otherwise what will happen is I'll suggest him fluoxetine and then he will send me a message, doc, this is the first medicine I took, it did not work. So it just makes a mockery of our whole experience.
Correct.
So I
Correct.
think kind of documents, if they can send beforehand, great. Otherwise, we withhold the decision till we see the documents, especially if it is important. Sometimes it could be simple things like some thyroid test, which they would have done, where we will only say, go and meet an endocrinologist. So what we will do there is, you do send me a thyroid report later. I will tell what can be done later in the message. So that can be taken up later. But if it is something we have to decide, it's a good idea to take the document and then decide, so that we kind of don't have a cut nose experience.
Right. Dr. Saranya had a question about, can it only be an audio consultation? I think that should be possible, right?
Audio consultations only can happen. In fact, I initially used to be a little hesitant to believe, is it going to be effective? I have seen so many people actually feeling much better with just audio consulting. That has given me the belief that, okay, I think I have my own bias, but in reality, something else is the truth. So I think audio consultations are very much possible. The tonality, the way we talk, the way we give pauses. Sometimes if you give enough time for them to talk about, I think it really makes a lot of difference, and people do have great experience even with just audio consulting, sir.
Right. A couple of questions about, say, defining the time duration of the consultation, as well as the consultation fee. Do you state it upfront itself so that the patient is aware of it and takes care of it, and it doesn't spill over to your next consultation?
Yeah, but definitely it's a good idea to inform them about the time for which they are scheduled to discuss, and if there are finances involved, what is the finance involved and all, is a good idea to inform. See, most of the times it is believed that people have an understanding about it. So we believe if somebody reaches out to us, they will also ask how much is the consultation fee and pay. But in telemedicine consulting, sometimes it becomes like chat room consulting, right? They just call you up and talk to you. So we don't know how they take it. So it's important for us to, if you want to keep it professional and those, it's a good idea definitely to tell them. We will have some people who will turn it off and will say they don't want to consult us. And there are a lot of resources. There are a lot of free consulting facilities which are available because they are funded by something else and some other agencies and those. So they can opt for these options if at all finances and other issues are in problems.
There was a question in our group also, which I think is very relevant, about recording of consultation by patient. Is there any way you would know that it is being done, and also you can prevent it?
See, anything online can be recorded. It is as simple as that. So we should be willing to forego some amount of privacy when we go online. That's the reality we have to accept. It is like if I have an online net banking account, I should be willing to have the risk of getting it hacked at some point of time or the other. That is the reality. So anything can happen. Now, see, at least personally, I don't explicitly tell you should not record, I am not recording and those things. See, I don't record any consulting, by the way. I trust and believe that they don't record. Now, sometimes it has happened in my routine physical consultations where I have felt that their phone is constantly on. So I asked them, are you on phone or are you recording something? And they say, yes, I'm recording this and those. Then I say, it's not a good idea to record it without asking me. I mean, it's not like I'm going to talk something which you should not be recording, but you should have told me. And I asked them to cut it off and those things. But online you can, I mean, if you're so concerned, you can do it. But let's assume that every consultation is recorded. Let us assume that unknowingly somebody is recording us, which basically means it becomes a filter system for us to talk only the right things. We are not going to talk unnecessary stuff. We're not going to talk something which is, we will not be able to defend tomorrow and those things. So let's assume all consultations are recorded and talk like that, which is the best way to be safe from our side, sir.
At the same time, you will have to maintain a document of the consultation, which you do,
Exactly.
right?
Yeah.
Okay.
I think currently only 2 documents are required, which basically means you need to maintain your consultation notes and you should maintain the time log of it and those. What I basically do is take a screenshot of the uh, phone call or the WhatsApp call and keep that along with the record and upload it and keep it. That's the simplest thing I do. That's the
Some
simple.
concerns about safety of WhatsApp and Zoom. How safe are they as far as the privacy goes?
Uh,
Any thoughts on that?
with respect to WhatsApp, they are as highly encrypted as generally any technology is available as of now. So it looks like they are a pretty safe system as such. The second thing here is with Zoom, of course, they have upgraded themselves now in the recent last few weeks. So they claim that they are different version now and those things. So I think these are all definitely pretty secure systems. But we also need to understand, if we are looking at an one-to-one consulting, right, the hackers are not interested in us, because most of the times one-to-one consulting is not going to make much difference for them. They are wanting to hack and do things which will give them money or reputation or bring down a country or something like that. For example, if I can hack the army system and show your country's army is useless, I think that's credibility for me. If I'm going to hack a doctor's consultation, it might not pay them that much, is what we need to understand. So I think we should be worried about it, but at the same time, we cannot become extremely paranoid. We should take our basic precautions and do what is necessary. Yeah,
There
that's
are a
what we
couple
need
of
to look
things
at.
also which have been mentioned. From my understanding, as far as consultations are concerned,
Mm.
proxy consultations are not allowed online. Is that right? The person has to give consent willingly that he is agreeable to have a consultation with you in writing, and also ID proof.
Uh, yes. See, for example, if you call me up asking for a consultation for yourself, whosoever it is, if you're comfortable and if you're comfortable with identity and if you have basically checked with their identity and those things, if you're okay with it, you can go ahead with it. But in case I want to talk to about my brother, spouse, friend, partner, whatever it is, I think it's a good idea to say, I know you're concerned about this XYZ person. I
Right.
can listen and talk to you, but for it to be effective, if that person reaches out, it'll be great. If they say they're not going to reach out, but I want to still talk to you about it, I think it's a good idea for us to say, talk to them and make them reach out at least once. And see, sometimes if you find that the other person is psychotic and not wanting to talk and those, then we can see, is there an alternative and what else can be done? Otherwise, as you rightly said, proxy consulting and those things without the other person's consent is absolutely no. Because you mentioned this, let me give an interesting point of how people uh, teach us technology. Like, for example, I was in a teleconsultation on a WhatsApp video call with this person. She said, my husband wants to talk to you. I said, I understand with your knowledge that your husband is in Chennai. How is he going to come during this lockdown time? She said, no, I'll put on conference call. So she immediately shifted to a conference call and continued the consultation. The good thing is both of them are there and it is automatically implied consent. So we don't need to worry about who is playing games out here and those things. So I think people come up with their own solutions if they're open. And those, where we should be worried is when we have some malintentions among people and partners and spouses and those, where litigations and those things are a challenge. Yes, you should be a little more careful, but most of the other times we will be able to help these individuals in the best way we can, sir.
Dr. Vijay Harbi-Shettar, do we have time for another question or so? Yeah, okay. Anonymous attendee has asked a question. He practices in a remote place and where patients are comfortable paying only in cash. So how to go about it?
See, the answer is, I mean, good to have something like Google Pay, Paytm, and those things and all. If they really cannot, and if they really want to pay cash, I think if you are willing to take the risk of waiting for them to come and deposit the money at some point of time, you could go ahead. And most of the times, I think we also need to understand that people who genuinely need our help and who know that it's worth paying and all, right, they also feel very hesitant that they've not paid you. They somehow make the time and come and consult and pay you back and go. Of course, there'll be always small bunch of people who might not want to pay for the services which are offered. I think that we should be willing to lose here. And if somebody has to come and pay, see, one of the things which they can do in people, especially in telemedicine consultation, is like, for example, if somebody has consulted me once and has not yet paid, if they fix an appointment second time, we can say, you please pay up the previous one, then this appointment can be scheduled. A very simple thing. The maximum loss here could happen is one consultation. And you also don't need to worry too much on, oh my God, this person has met me 10 times and not paid up, and feel bad about it and those. So I think we should be willing to lose some amount of it, because there will always be people who will utilize the system for their own advantages. We cannot stop it. But I think talking to people, most of the times, most of them are very genuine. They'll reach out to us the right way.
Certainly, yeah. Probably the last question
Yes, sir.
goes back on the recording, which you have already answered in detail. In case if there is an incident or like a suicide, an unfortunate suicide, and can we be held responsible for behavior of your patient? My simple answer is no. How can we be held responsible? As far as we document, we maintain our records as to why the person has contacted us and what the consultation you have done and what's your advice. Everything is there. Whatever records you maintain, that should help us in good state. Is that right?
You're absolutely right. And suicidal ideations, as per the Mental Health Care Act, is an indicator of stress and need of a mental health professional. It doesn't say anything else. And our knowledge, of course, about abetment of suicide says just because we are involved doesn't mean we are responsible for their suicide. Until unless there is an act of omission or commission or pushing them to lead to that extreme steps and those. So I think it's important for us to realize we should be worried, but at the same time, we should not be paranoid about the whole litigation process. See, that is the worry, that sometimes we are losing our human element and kind of becoming very worried, which only makes us become the tick mark consultant, where we are only wanting to ensure that I don't get a case out of this person. We are not worried about whether we are able to help them or not. We are not worried about what they do or not. If they don't put a litigation against us, we are happy. So I think we need to kind of deal it in a more balanced approach. Take the basic precautions. Most of the times, we should be able to deal with it and address these scenarios pretty decently, sir.
Yeah, absolutely. I think the general rules and regulations what apply for a face-to-face consultation, we still have to follow even in the digital world. With this,
Exactly.
I think I would like to thank Dr. Sunil Mohan for a fantastic presentation and taking the questions. And Dr. Sunil, thank you very much. And
Thanks.
if I remember right, all of us who are going to practice or who are already practicing will have to go through a course in telemedicine sometime or the other. And so you are already there probably as a trainer, and you can take the classes for all later. So thank you once again, Dr. Sunil Mohan, for taking all the questions and the presentation. Would like to thank all the our coordinators as well as Mr. Ganeshan from Micro Labs. Thank you all. Have a safe evening. Good evening. Good night to all of you.
Thank you very much.
Thank you, Dr. Madhukar.
Thanks.
Thank you, Mr. Ganeshan. Thank you, Mahesh. Dr. Mahesh, you want to say something? Done? Okay. He's not here. Okay. Right. Thanks, Mr. Ganeshan, for supporting this event. That's very kind of you. And thank you every individual, every participant who has actively participated. And there's so many questions. This was attended by about 77 people. In the last two, if you take last 2 weeks, it has been this has been the highest. And I'm sure this has been a very productive session. The feedback has been excellent. Already, Dr. Swaminath said Sakat, and it's been a fantastic evening. Thank you very much. Thank you very much, everyone. Yeah.
Thanks a lot, sir. Thank you.
With this, we
Thanks.
sign off. Yeah, thank you.
Thank you.
Thanks.
Thanks a lot.